Resuming debate, the honourable member for St. Paul's.
Thank you, Mr. Speaker. I am pleased to speak today to Bill C-356, an act respecting a national strategy for dementia. According to the World Health Organization, as we've heard, there are roughly 35.6 million people around the world who are currently living with dementia. This number is expected to double by 2030 and more than triple by 2050. And in 2011, 14.9% of Canadians aged 65 and older were living with cognitive impairment, including dementia. By 2031, this figure is expected to increase to a shocking 1.4 million people. And today we face the combined cost of dementia totaling $33 billion per year. This is not something that Canadians can afford, both economically and socially, to continue to occur. We need to enact change by putting in place a national strategy for dementia. The Liberal Party supports the need for a national plan to address Alzheimer's disease and all other forms of dementia. Canada today has almost as many diagnosed dementia patients as the United Kingdom does, at 847,000, despite a difference in population of 30 million. In BC, more than 70,000 people have this disease, while another 15,000 people are diagnosed. Each year. Canada pledged in 2013 to find a cure or treatment for Alzheimer's by 2025. As one of the only G7 countries still without a strategy, our time to do so is running out. The Alzheimer's Society of Canada, as well as the Canadian Association of Retired Persons and other related organizations, are united in calling for stronger political leadership to battle this debilitating disease. They recognize society's need for our current government to support Canadians in their difficult battle against dementia and to find a treatment for it. Another organization, Baycrest Health Sciences, and its Rotman Research Institute, is also working to accelerate scientific research regarding dementia. This institute recognizes that a person's risk for dementia doubles every 5 years after age 65. Their strong focus on the relationship between brain health and aging helps them to understand that as fewer people live to see these older ages, the number of Canadians with dementia would be able to be cut in half if its onset was to be delayed by just 5 years. With the implementation of Bill C-356, such research would be able to be carried out with promise for viable results. Unfortunately, however, federal leadership is required for any such action to occur on a pan-Canadian dementia strategy. Once again, our current government is not doing enough. In October 2014, Minister of Health announced she was in the, quote, early stages of discussions with the provinces to establish a national dementia strategy. The 2014 federal budget also promisingly committed new funding for research into age-related neurodegeneration. Sadly, this only represents a fraction of the resources truly needed to even begin to focus on approaching this disease. Alzheimer's disease puts enormous emotional stress on millions of families in Canada and costs our healthcare system billions of dollars every year. Delaying the onset of Alzheimer's by 2 years can save our healthcare system $219 billion over a 30-year period. And a national strategy for dementia may be able to make an astounding difference in advancing research in order to work towards achieving this goal, which would diminish the enormous economic hardship and subsequently, and most importantly, improve the lives of affected Canadians. As recently published in the Toronto Star, another possible solution has been proposed by the Alzheimer's Society. This organization is recommending that an arm's-length not-for-profit organization be funded through the Public Health Agency of Canada at a cost of $30 million over 5 years. It would be responsible for research coordination, training for healthcare providers, delivery of healthcare services and education, including how to recognize early signs of the disease that affects people in their 40s and 50s. Such a program may provide a possible approach to relieving such aforementioned pressures. In our last election platform, the Liberal Party laid out a clear, comprehensive strategy for tackling the issue of dementia. Along with directing attention towards the economic issues, we focused on awareness, education, and prevention to support families and combat the social stigmas of dementia. The social implications of this disease are in as equal need of many support services as related economic ramifications. Coping with the effects of caring for a loved one with dementia is exceptionally difficult. The Mental Health Commission of Canada recently issued a report of mental health indicators, which showed caregivers are facing enormous emotional stress caring for elderly parents and sick children. So many women are leaving the paid workforce in order to care for a loved one of their mother, their mother-in-law, their aunt. There are so many stories that we all know. Or they end up having to take a lesser paying job in order to be able to meet the needs of the loved one and family member. It's therefore necessary that we disseminate proper knowledge and the best practices possible in order to foster improvements in the quality of treatments and support for patients and families coping with these brain disorders. And we also work to ensure their economic security. I commend at Mount Sinai Hospital the Reitman family that has funded a unit there that supports the families of those suffering from Alzheimer's in order for them to give the best possible care, and that it is sometimes so difficult and frustrating, I think, for families to actually have to provide care without really understanding the frustration that is required and how normal it is to feel that way. This bill would require the minister to initiate discussions with provincial counterparts within 30 days of its coming into force in order to achieve its objectives of developing a national plan with national objectives. Mr. Speaker, I don't believe there's any strategy that can just be a laundry list of things that government's already dabbling in, which seems to be what this government thinks is a strategy. A strategy has to be what, by when, and how, and actually be able to identify the partners that will be necessary to actually make the strategy work. Such a process would help establish a method of receiving actual input from affected Canadians and will continue to support greater research and implementation of related technologies. Bill 356 will also work with international community in improving clinical guidelines in order to produce the best abled practices for care, support, and prevention of dementia. By investing in both research and prevention of Alzheimer's, we can delay its onset for as long as possible, so while all Canadians could live their lives to the fullest potential. And also we need to the research and practice-based evidence in order to determine what is the best possible support we can give to the families of those affected. We must work together to support this act and, most importantly, bring necessary aid to those so desperately in need. Thank you, Mr. Speaker.